case report on successful management of postoperative vitritis. So my patient is a 64 years male, presented to our OPD with chief complaints of diminution of vision of the right eye since the last 2 days. History of present illness. On elaboration, patient underwent an uneventful cataract surgery of the right eye on 7th of March, and on postoperative day 5, he presented to the department with progressive diminution of vision that started since the last 2 days, which was associated with mild pain and watering. There was no history of any fever or any other systemic infections. Patient underwent uneventful cataract surgery of the left eye 4 months back in our hospital. There is no history of any similar illness in the past. Family history, there is no significant family history. Patient is non-diabetic and non-hypertensive and has no known allergies. General examination of the patient were all within normal limits. Systemic examination was again within normal limits. Coming to the ocular examination, on the first day of presentation, that is postoperative day 5, the visual acuity of the right eye of the patient was PL positive and PR was accurate, whereas on the left side was 612. The anterior segment findings of the left eye were all within normal limits. For the right eye, the intraocular pressure, which was measured by non-contact tonometer, was 24 mm mercury. The extraocular movements were full, free and painless. The lids were normal. In the conjunctiva, mild congestion was present. The cornea showed descendant membrane folds with microcystic edema. In the anterior chamber, hypopyon of 2 mm height was noted, and cells and flares of grade 3 was present. The iris details were clear and the pupils were sluggishly reacting. The PCIOL was in bag and retrolental exudates were noted on dilatation. Fundoscopy, very poor fundal glow due to vitreous haze was seen, whereas of the left eye, the media was just mild hazy due to posterior capsular opacity. The rest fundus findings were within normal limits. So this is the slit-lamp photograph of the patient of the right eye on postoperative day 5, where we can see the corneal haze due to microcystic edema and descendant membrane folds. Hypopyon of 2 mm height can be seen here with PCIOL exudates. On the same day, a USGP scan was done where we can see mild to moderate reflectivity in the anterior hyaloid, anterior vitreous cavity. The hematological investigations, the patient had borderline increased levels of white blood cells. Then the rest of the investigations were all within normal limit. The patient was given injection dexamethasone 2 cc IM, and he was started with prednisolone acetate 1 hourly, hydroxyfloxacin, hydroatropine, and systemic antibiotic tablets of cefuroxime, pentopen, NSAIDs. On the postoperative day 6, vitreous tap was done and sample was sent for culture and sensitivity. Patient was also given injections ceftazidime and vancomycin intravitreally in the right eye. The gram stain and KOH mount showed no organisms and the culture report showed no growth. So the oral prednisolone was started, and which was continued for 1 month in a tapering dose. So these are the serial postoperative photographs. The first picture showed again microcystic edema on day 6, which was cleared on day 14th. And the last picture showing slit-lamp examination of the anterior segment on the 2nd month. This is a serial photograph of the patient on the end of the 1st month, which showed floating vitreous opacities. So on the last follow-up, on the 3rd month, we can see the patient had improvement in the visual acuity from PL positive to 6.9, which was with minus 0.5 spherical lens and minus 0.25 cylindrical lens in the axis of 95 degree. Intraocular pressure of both eyes were again normal, and the rest of the anterior segment findings were normal. These are the differential diagnosis. The case summary: the 64-year-old male presented with progressive diminution of vision with pain and watering since postoperative day 5. Injection intravitreal of ceftazidime and vancomycin were given. Vitreous step was done and sent for culture and sensitivity, which showed no organisms or growth. Systemic steroids were started for a duration of 1 month, with which the patient showed dramatic improvement. Thank you.
So it is a case of post-op endophthalmitis or toxic lens injury?
So now we can say about maybe lens induced. Lens
Endophthalmitis.
So what was your diagnosis? What was
Endophthalmitis, post-op endophthalmitis, or
Initially we
the
thought it to be post-op endophthalmitis. But then on the second day he showed improvement after giving oral steroid.
Was the patient seen on day 1 and day 2?
On day 1 he was sent in discharge, seen in discharge.
And day 2 he was not seen.
so corneal involvement was on day 1.
My microcystic edema was there.
Was there. That can be due to
It's a prolonged duration of surgery.
any point in favor of toxic lens syndrome. So do you think it is a post-op endophthalmitis? Any role of systemic steroid? You are giving a systemic antibiotic?
So, no sir. Initially we thought endo, so we gave systemic.
What? Okay. Thank you. This is a case of post-op endophthalmitis. Thank you. कहाँ से हैं आप?
Asam.
हैं?
Asam.
Assam. Good. ठीक है presentation.